right now we'll be going to Kaduna to speak with the executive governor of Kaduna State, Mallam El Rufai. Good morning, sir.
Good morning.
First of all, we'd like to congratulate you on your recovery.
Thank you.
All right.
Thank you very much.
All right, sir.
It was a miracle, but yes, I've fully recovered. I'm not back at work yet, but I'm okay. I'm fine.
All right.
As you can see.
Thank you. Thank you for sparing time to do this. The first thing we want to ask you, just for general knowledge, because the whole country is watching this, and for informative reasons, what has been the broad outline of Kaduna State's response to the COVID-19 pandemic?
Well, the moment this pandemic was declared a global health emergency, our team of technocrats and public servants in Kaduna State brainstormed and determined that we are going to face, as a state, as well as the country as a whole, a trilemma, a choice between what to prioritize. Is it lives, livelihoods, or liberty? And we concluded that COVID-19 is both a public health and socio-economic emergency, and we have to choose what to prioritize. And in our own case, we decided that we prioritize protection of lives, because livelihoods can be rebuilt when destroyed. Liberty can be restored when lost. But life, once lost, can never be recovered. So our strategy from day one was centered around what steps do we need to take to protect the lives of the people of Kaduna State. And we decided that we do. It did not matter what it cost us. We'll do whatever we can to protect the lives of the people of Kaduna State. We'll inconvenience people and apologize later. We'll affect livelihoods negatively, but we'll apologize later and try to rebuild those livelihoods. So our strategy from day one was, how do we ensure that this virus does not spread in our state? Because our public health system has no capacity to handle it. The entire number of ICU beds in Nigeria at the onslaught of this pandemic was 350 for the entire country. And in Kaduna, we just have like 20 ICU beds. So how are we going to handle the situation if we have 1,000 people requiring treatment? So we knew we couldn't handle it. So our best strategy was to ensure that we prevent the spread of the virus. So we're the first state to lock down. We're one of the first states to close our schools, because we realized that it is only through ring-fencing our state from this other states that will import the virus that will be able to protect our people better. And we also realized that this is an opportunity to strengthen our public health infrastructure. We are in the process of building a permanent infectious diseases hospital. The one that we have is just for 16 beds. We're building a 139-bed infectious diseases hospital, which will be completed in the next 8 weeks. We are building infectious diseases wards in each of our general hospitals, in each local government, each of the 23 local governments. This will be 20 to 30 beds in each of the local governments, but the main hospital will be here in Kaduna. And I want to say also that we realized from day one that the key to containing this pandemic is to do what we call the 3 T's. Trace, whenever there is an infection, trace everyone associated with the person infected, test, and then treat. Now, when this thing broke out, we did not have a single testing center in Kaduna State. Today, we have 2 that are working, and so far we've tested nearly 400 people. We hope to have a 3rd one commissioned next week. The equipment was installed yesterday, and we hope NCDC will certify it okay during the week, so that we have a 3rd testing center. Also, we are bringing in mobile testing centers that can go into every part of the state and test people in the event of community spread. And we believe that by the time we have all this in place, we're expanding our treatment facilities. As I said, we have taken over an hotel and converted into a treatment hospital. We have a third treatment hospital and isolation center at the All Pilgrims Camp, where we are camping the Almajiris. As I announced some days back, we received 169 Almajiris from Kano, and so far 21 of them have tested positive. We expect more to test positive over the days. In fact, the spike in our numbers have largely been the Almajiris and other people that have come to our state. So we have been successful in closing down our state, in reducing the traffic into the state. And each and every case of COVID we've had in the state has been imported. I was the first case, I was the index case. Fortunately, I would say, because it served to scare everyone into the state to come up to the reality that COVID is real. It's not a joke. I was the first case, and I got it in Abuja, and I infected 4 other people. Happily, all of us are okay now. We are all back to our normal lives. But that is the broad lines of our. But in addition, we also took extraordinary steps to get PPEs for our health workers. We didn't want to expose any of our frontline workers to any risks. So we have a lot of PPE for all our health workers. We've also insured their lives to the tune of 5 million. Anyone that dies in this process, his family will get 5 million naira. And we have also additional disability insurance for those that get sick, cannot work, but no death. And we are also giving a special allowance to all health workers, as well as extraordinary allowances for those on the front lines. So this is the broad strategy we've adopted in Kaduna State, and we're implementing with all energy and focus.
All right, sir. I'll take the second question, particularly from all you have said. Kaduna State government's effort has communicated that it focuses to ensure that as few people in the state as possible get infected by COVID-19, with the emphasis being on prevention, because it is the prudent thing to do to save lives, given the limited capacity of our health system. Now, so the question is, there's a broad paraphrase of your words, all right, of the speech you gave announcing your recovery, and it does seem to be working. However, the numbers show also that a significant portion of the population are vulnerable and are unable to make a living due to the quite necessary lockdown. So let's talk about Kaduna State. How have you been supporting the less privileged during this lockdown?
Yes, well, from day one, as I said, we realized that the lockdown will affect livelihoods. There are people in our state that make their living from day to day. They do not have the security of a monthly salary. They are in the informal sector. 60% of Kaduna State's GDP is from the informal sector, the petty traders, the transporters, the daily paid laborers that work on construction sites. So in designing our lockdown, which we refer to in the quarantine order as partial lockdown, we designed it in a way that our construction companies, for instance, will keep operating. So all our road works, all our construction works are exempted. They are considered essential services, and the workers of those companies were exempted from the lockdown. So construction works continue. That way, all those employed in the construction industry will continue to have jobs. We gave badges and exemptions to the construction companies to continue working. That is one. Secondly, we exempted food, grocery stores and pharmacies from the lockdown. That is a significant portion of our informal sector, because most of our petty traders are in this business of selling food and groceries. So we exempted them, and they are allowed to operate to a large extent. Again, that has taken a large chunk of the informal sector to still be working. But we also estimated that in Kaduna State, between 20 and 30% of the population is vulnerable and will therefore require food intervention. We therefore drew 500 million from the contingency fund of our 2020 budget and bought food items and packaged them and targeted 9 urban local governments, because most of those that are vulnerable are the urban poor, those that came from the rural areas to the cities looking for work, and they have to work from day to day to earn a living. So we targeted the 9 urban local governments, and we spent 500 million plus other food donations from other good-spirited people, and we shared that. Now, that was a challenge, because identifying who is entitled, who really needs this, is a problem, because we have no database of poor people that we can rely upon. We tried to use the national social register that is used to give the monthly 5 or 10,000 from the National Social Investment Office, but it was not adequate. We therefore relied on community leaders. So in each cluster, we appointed a committee headed by the village head or the district head, with the pastor and the imam from that cluster, with representatives of women's groups and youths, to identify within their communities who is entitled to this food intervention and distribute. It has worked in some local governments, it has not worked in some. Some of the people we trusted abused that trust and didn't do what they were supposed to do. We learned our lessons. However, we are now planning a second round. So we intervened. We provided food to those that cannot have food unless they go out to eat. We tried to do that. It has been reasonably helpful in lowering the needs of the people. We are planning a second round now in May. We did that in April. The second round in May, I'm happy to say that we are spending, or we are distributing food of approximately 2 billion naira to all the 23 local governments. The largest donation of food came from Kakobit, the private sector group led by Aliko Dangote and others. They are providing 900 million naira worth of food items to Kaduna State. Our public servants are contributing about 700 million. The state government has raised 200 million from other donors, and we are matching what our public servants are going to have sacrificed to ensure that we have 2 billion naira that covers all the 23 local governments. And this time, we are not trusting communities to pick who is entitled. For communications and digital economy, we've obtained data of the poorest people in Kaduna State using their phone recharge purchase records. So we believe that anybody that spends less than 200 naira per month on buying recharge card for his phone is poor and will need this food intervention. And we'll have your phone number, we know your address, we'll just call you and deliver the food items to your house. So we hope that this second round will be more targeted. We'll get to those that are really, really poor from their phone records. Of course, there are those without phones at all. They are so poor that they don't even have phones. And we rely on communities then to identify those. And our hope is that this will help. But on the whole, as I said, our lockdown was designed in such a way that a significant portion of the informal economy still operates. For instance, we open the state twice a week, 2 days in a week for people to restock. But when we noticed that the markets get congested on those days, we decided to close all the major markets. We borrowed a lift from Lagos, actually. We are closing all the major markets. We have established temporary markets that will start operating today in our public schools and other public facilities, so that we maintain physical distancing. We ensure that everyone wears face masks, and there will be wash points where you can wash your hands and maintain hygiene and so on. So we started that experiment today. But our lockdown did not deprive people completely of their livelihood. Some have been deprived, but a significant portion are still earning a living. So that has been our approach, and we think it has worked reasonably well so far.
All right, sir. I will ask one more question. The first one, you have spoken about prevention, conscious about the health of your people. The second one about the program for the poor. But listening to you, I've heard you speak about government being a perfect science, that you run your government in a scientific way. And I'm sure you are also a person who believes in business and commerce. So what we want to ask in terms of business is that we want to ask about your thoughts concerning the impact and the economic effects that this is having upon your economy, the state's economy and finances. What are on the plans you had and forecasts for 2020? So what are your thoughts on the economy post-COVID, particularly with the drop in oil price, which might affect revenue?
Well, this is a major problem. But you know, this crisis is also an opportunity. For long, Nigeria has been saying we need to diversify our economy from reliance on oil. Well, this is the time. Oil is down to $20 a barrel, maybe 30 at best, and it's not going to take us anywhere. For Kaduna State, that relies on Federation account for 50% of its budget, it is a major challenge to see oil prices crash from $60, $70 a barrel in January to less than $30 now. It will have a major impact on our economy, and we need to now start thinking of diversifying. For us, the post-COVID economy will be a different kind of economy. The new normal post-COVID, when we get out of this, and I know we'll get out of this by the grace of God, will open up opportunities in other areas. Many industries and businesses will take such a hit that they may never recover. Hotels and tourism and such businesses are going to take a big hit. Transportation, aviation are all going to take a big hit. However, there are new areas of new businesses that will be able to absorb people with the appropriate skills. For instance, online businesses, online grocery stores that you order your groceries online and they are delivered to you. The logistics delivery business will thrive. New businesses should come up. And here in Kaduna State, we're actually encouraging the emergence of logistics businesses, because we don't want people going to the market now or even after post-COVID to be going to the market and mixing too much, buying groceries. You can order online and it can get delivered to you, which requires enhanced internet connectivity, but the investments are being done. As a government, we have to operate online. Is almost compulsory now for all governments to move towards e-government completely, and e-services to citizens. Education, a lot of education has to change and be online. Telemedicine will emerge and thrive, and we also see an opportunity to provide liquidity to our small and medium enterprises and connect them to global value chains, so that what we produce not only can be consumed in Nigeria but exported. But for a state like the Kaduna State, which is a leading agricultural state, we are the leading producer of at least 4 or 5 commodities: tomatoes, maize, soybeans, ginger, and sorghum. We are the leading producers. We produce 23% of Nigeria's maize. This is a great opportunity to expand production for the domestic market as well as exports. So post-COVID, industries are going to change. There will be major shift. There will be creative destruction of some industries, but the emergence of new ones. But what is very, very important is the need to educate our people, to ensure that they are healthy, and to ensure that they have skills, particularly ICT skills, digital skills. And I'm proud to say that Kaduna State is one of the leading states, at least the leading state actually in northern Nigeria in terms of imparting ICT skills. We have an ICT hub that has trained hundreds of people that are already making money online from ICT and other related businesses. So that is our view of the future. That is what we are working on. And our Ministry of Business, Innovation and Technology is working around the clock to ensure that we prepare for that post-COVID future. Finally, our State Executive Council has formed a committee, a subcommittee, to start working on scenarios of relaxing the lockdown. As soon as we have a handle on the infections in the state and we have a map of community spread, we have enough testing capacity, we are going to relax the lockdown gradually, particularly in light of the fact that the rainy season is around the corner and we must produce food. So we have strategies in place. Government is not a perfect science, I must say. We think through issues, we come up with what we think are the solutions, and we try to implement with focus. But as we implement, we tweak here and there when we see mistakes or we get better suggestions. And in this matter of coronavirus, everyone is guessing. It is a novel thing. There isn't enough data. There isn't enough policy choices. There aren't enough studies for anyone to make perfect decisions. But what is important is to prioritize what you want to achieve and decide and be decisive, and then make adjustments when you realize that something that you thought will work is not working. And that's what we are trying to do in the Kaduna State government.
Thank you very much, Your Excellency. We'll have loved to tap more into your intelligence, but we have run out of time. Anytime in future, we are sure we'll link up back to you. Thank you very much, and thank you for the good work you're doing in your state. God bless you.
Thank you for inviting me. I'm very grateful.
All right, thank you.
You're welcome back to the Platform Studios. And yes, we just listened to a very good interview with Pastor Poju and His Excellency, the Governor of Kaduna State, Mallam Nasiru El Rufai. Now, I have two new guests with me here in the studio, Mr. Funsho Shobande, an economist, an ex-banker and a financial consultant, and Mr. Soji Akinkugbe, a serial entrepreneur, but also a medical doctor.
Yes,
You're both welcome, sirs.
Thank you very much.
How are you today?
Very well.
Mr. Shobande, let's start with you. I remember when we were talking beforehand and you said this is the first time you've been out of your house in a while, obviously because of the situation. You wrote an interesting article about the new normal, which is a big conversation now, post-COVID life, the new normal changes, and you talked about the 5 Fs. Please expatiate on that.
Thank you very much. I was talking about the 5 Fs within the context of a lockdown. The lockdown is something that has come to many in different ways. To some, it's business as usual. I have a friend, for example, who lives on an island in Badagry, so he goes out only twice a week. So for him, a lockdown is not new. But to many of us, the lockdown poses a number of problems. There's the anxieties of day-to-day living, and the article was written with the intention of letting people know how they could possibly cope with the lockdown. So I introduced this concept of the 5 Fs as a coping mechanism. The 5 Fs being faith, family, fitness, finance, and freedom. We all need to have faith in these times that this too will pass. As you know, faith is that assuredness and certainty that you have what you believe and desire already. And I think it goes a long way towards helping us to cope with the lockdown period. We must have faith that there is a God who has allowed and permitted this to happen for a particular reason. We must have faith that He is just and able to see us through it all. And so we must ensure that we use this time to be able to encourage and build up our faith as we go through and navigate our way through this crisis. So that's the faith aspect of it. With the family aspect, many people are finding themselves having to be in close proximity with their family by choice. I mean, not by choice, but by the circumstance. There are no business meetings to attend. That's happening online and so on and so forth. So it's a time where people should spend building up their family altar. You know, the place of prayer in the family. It's a place where, it's a point where people have to reflect and try and see how they can create their family vision if they don't already have one. Sit down with your family, plan, engage with them in useful discussions, spend time. In most families, the father figure is usually an absentee. He's left home before the children go to school, and by the time they come back, they are in bed. It's a time where you can then build on a family vision, consolidate on having the close relationship. But we also note that there's been a byproduct, an undesirable byproduct also, because it does appear that incidences of domestic violence have also cropped up during this period. People are having to cope with one another at close quarters. And so the family aspect has to do with how you can deal with all the anxieties and pressures that would arise within the family. Who does what? You know, it's a time to re-examine the budget. It's a time to be open and have open discussions with your family, because God forbid, you know, many families have had to be separated and not even able to say their goodbyes. So it's a good time for people to spend at home in good quality time. One of the things we were able to practice in my family was to have, and this was done across the extended family. We had my niece, who's based in the UK, organize family time. So it was a game she organized with all the other members of the extended family, wherever they were, in Canada, in London, in,
Wow.
yeah.
This came out of COVID lockdown?
This came out of COVID lockdown. So she put up these sets of 50 questions, like a quiz, and we chose teams. So the mere fact that I was based in Lagos didn't mean I couldn't have a team member from another family in Canada. So we chose teams, and you know, we played this game, and it was really
Zoom
very...
or WhatsApp or
Yes,
what platform?
Zoom. We used the Zoom platform.
Interesting.
Yeah.
And I like that, because we're used to using Zoom for meetings, business meetings, and all of that. But to think that it can be applied in family bonding,
Yes,
is actually so good.
it was indeed a very, very nice exercise. So I encourage people to use that time to develop the bonds within the family. The other F aspect has to do with staying fit. Fitness. We must remain fit throughout this period. Otherwise, I mean, the average Nigerian would probably be doing 2,000 steps a day, which is basically coming out, getting into your chauffeur-driven car, going to your office, climbing the stairs, or using the elevator, and you know, the reverse. But suddenly we're finding ourselves at home with the temptation of the refrigerator, and all the goodies in it is there. And there's a fair chance that many people will come out of the lockdown, you know.
Fat and flourishing.
Exactly, fat and flourishing. So it's a good time to set aside some time to stay fit and to exercise and do your bit in terms of exercise. You know, even it's biblical to say that I wish you well and that you prosper even as your soul prospers. You have to do some form of exercise, get the muscles moving, and make sure that one is fit and healthy during this period.
Okay, we'll come back to the two remaining Fs. I know we still have two Fs, but I want to quickly talk to Mr. Kinkugbe. And I want us to talk about education, because you also put out an article that has also gone around, and you talked about nation building, the impact on health, the impact on education. And education is big now. I mean, homeschooling, online school started some weeks back for some schools. There was even a challenge that Lagos State came out and said they should stop, because obviously public schools might not have the capacity and the facility. How does this really impact education, and what can we do about it, and how can we all benefit from this situation?
Well, I mean, thank you very much for having me on your program. I think that I come from a slightly different perspective from Mr. Shobande in terms of the way I look at our own situation and our peculiarities. You did mention that government said, you know, Lagos State said public schools, all schools should close because, you know, public schools don't have the facilities for online education and all that. And I think that it's important for us to address education holistically. All our issues have to be addressed holistically. Nigeria, for the better part of my awake years, has always been addressed from a perception of us and them. And actually, we are us, and we are them. So until there is some form of commonality in our vision and our focus, then we will not be at the same place where we are today. So when we talk about education, I mean, the reason why I'm particularly soft on education is because of the fact that, I mean, I'm a third-generation medical doctor. Not many Nigerians are in that position. Soon after school, I said I wanted to pursue a line of entrepreneurship. I spent my life learning all kinds of things, from carpentry to tailoring to joinery to welding to, even more recently, even stage production. So, and the basis of it is because the foundation of education was strong. Education gives you the confidence to be able to think. It gives you the confidence to be able to ask. It gives you the confidence to be able to be of value to the society. So, running a factory for over 20 years, you've had to rely on people that have had very little education, so you had to bring them in, you had to empower them at great cost through your own endeavor. So we find ourselves all of a sudden marooned in this situation, you know, whereby everybody is now on a reset button. Now, it could be an opportunity, it should be an opportunity that we ask ourselves, why is it that there's so much of a difference between what we need to do for some people and what we need to do for others? Because at the end of the day, the sum total is who we are.
As a people.
As a people. And that's where the focus has to be. Whereby, as I did mention in my article, that if I see a public school in Sokoto and I see a public school in Asaba, there must be some similarity. You understand? Because at the end of the day, you want a situation. Of course, there would always be people that are particularly strong in whether it's maths or physics or biology or something. You know, we all have our talents. But everybody must be given the foundation. And I think that is where Nigeria has struggled and continues to struggle, you know, with this foundation, with that the foundation is at best some level of an equilibrium. And I think that this is the discussion that this has even brought out even more, that we need to have. And we need to be intentional about it, and we need to be honest about it.
Okay, so yeah. I need to hold that thought, because now we need to go back to continue the main interviews. But you stay here, and when we come back, we'll continue this conversation. So right now, we need to go back to the main studio, where we would have with us His Excellency, the Governor of Delta State.
The Platform Nigeria celebrates all medical and frontline workers in the battle against this epidemic. Some have given their lives to keep us safe. Nigeria and the world will forever be grateful to you all.